As with any surgery, bariatric surgery does have its risks, and obesity increases the risk of any surgery. These risks include the risk of anesthesia, bleeding, infection, blood clots, heart and lung problems, or even death.
The mortality rates for weight loss surgery used to be much higher. As we've created these centers of excellence and we have improved our outcomes, they have dropped tremendously. Most centers of excellences have a statistic of around 0.5%. Ours is much lower and is less than 0.1%. As you can see with this graph, there are differences with the surgeries as far as how fast you lose the weight. With the gastric bypass and the sleeve gastrectomy, you in general are going to lose most all the weight within that first year. With the lap band, the weight loss is slower. Although you can also see by this graph, you eventually catch the gastric bypass and the sleeve gastrectomy. We have some patients that do much better than the average. They lose 80, 90, even 100% of their excess weight loss. We also have patients that don't make the average. This is where your part of the commitment comes in. This is where how well you do with diet and how well you do with exercise factors in. If you want to do better than the average, then I tell patients, you need to work harder than the average patient. If you want to do upwards of that 80, 90%, you want to get most of your weight off, you're just going to have to work harder. The beauty of these surgeries is that it makes it easier to do so. It makes the diet easy. It makes it so you feel very full eating that small amount of food. You feel very full eating very limited amount of calories. Now, what calories you eat are up to you.
Let's look at what you can expect after the surgery. With any of these operations, we can perform this laparoscopically, which means very small incisions and a quicker recovery. In fact, with the gastric bypass, we can even perform this robotically. As far as a hospital stay, most of our gastric banding patients go home the same day. Nowadays, most of our sleeve gastrectomy patients go home the same day, although they may want to stay overnight as an outpatient. Our gastric bypass typically stay 1 or 2 nights in the hospital. We have you walking around the same day as surgery. We also gradually advance your diet. You can expect to be on a liquid diet for the first 7 to 10 days, then advance through a puree diet to a soft diet over the next week to 2. You'll get a lot more information about what you can and can't eat from our registered dietitian when you see us in the office.
I'd like to make a special note to women of childbearing age. It does become particularly important to avoid getting pregnant that first year after surgery. It is especially important for patients who undergo a sleeve gastrectomy or gastric bypass procedure. We have started a process of rapid weight loss, and by doing so, if you became pregnant, you would put the baby at risk for miscarriages or fetal defects. We have to stop the weight loss process and make sure that that baby is getting enough nutrition. And after you deliver, you never get back on that weight loss program again. Whereas if you wait and lose all your weight and level out, then become pregnant, you can just gain the pregnancy weight and come right back down to where you were before.
Let's look at nutrition and exercise after surgery. When you're drinking after surgery, we like you to focus on a small amount, about a shot glass size, every 10 or 15 minutes. When you're eating solid food, it's very important to chew your food very thoroughly. When you're drinking, you can continue to drink every 10 or 15 minutes a few sips. But when you eat a solid meal, we like to have you refrain from eating and drinking at the same time. So when you eat your meal, wait 45 minutes or an hour before you have something to drink. Vitamin and mineral supplementation are important, especially after a gastric bypass, because of the small degree of malabsorption we've induced. It's really quite simple. We have you chew up 2 multivitamins in the morning, 2 calcium tablets in the evening, and once or twice a week a vitamin B12 under your tongue. We'll monitor your laboratory values, including your blood counts, your iron levels, your vitamin levels, and other mineral levels, to make sure that you're getting the appropriate nutrition, and we can adjust those as necessary in your follow-up period. Most importantly, we want you to exercise. We understand that exercising at your current weight might be very difficult. We understand that. Therefore, it's important to start with a very modest goal of getting up, getting around, and moving in the early postoperative period. But we want you to continue to progress, so that in the long run, the goal should be exercising in order to get your heart rate up and get sweaty 30 minutes a day, 5 days a week. It's really important to help you achieve your weight loss goals.